Thank you, Marcus. Well, it's a medical condition that affects the nervous system, and we're going to learn more about it. It's called POTS, and we're learning more and more from doctors that are at Vanderbilt Medical Center. You know, POTS actually causes a number of symptoms, like when you transition from lying down to standing up, it can cause your heart rate to just race, make you feel dizzy, even fatigued.
Wow, and while there is no cure, there are treatments and lifestyle changes that can also help you manage it.
Yeah, there is. So...
And here to break it down for us right now is Dr. James Muldowney from Vanderbilt, and Victoria, a POTS patient. Thank you both so much for being here.
Welcome,
Thank you for having
guys.
us. I appreciate that.
Thank you.
So we're going to start with you, doctor.
Yep.
I had never heard of POTS until about a year ago from my friend Victoria. What exactly is POTS?
So POTS is a disease that can occur after an injury or after an infection. And what happens is that when you stand up, your heart rate rises at least 30 beats per minute, and you feel lightheaded, nauseous, dizzy. You can get headaches. It can cause you to feel like you're nervous and anxious when you're really not nervous or anxious. It's just your body is on red alert. And it takes about 3 to 6 months for really to kick in and for you to start really noticing it.
And I've heard it's hard to sleep too, because if your heart rate is going.
Yeah, so a lot of our patients have sleep issues. Their hearts generally don't race while they're lying down, but they still don't feel well, and it can disrupt your sleep cycle.
Okay.
How common is it? Because I mean, I feel like, you know, a racing heart could be a number of things, right? It could be anxiety, could you just whatever had some coffee before you went to bed or something like that.
No,
how common is POTS?
So there are about 500,000 Americans who have POTS. So it's not terribly common, but it's not terribly uncommon. Since the COVID pandemic, we're seeing a lot more people have it, because when 80 million people get a virus, you're going to start seeing more of this problem. But for our diagnosis, you have to have these symptoms for 6 months, and they can't be from some other cause like anemia, caffeine, medication side effect, or whatnot.
Let's go through some of those signs and symptoms real quick. I know we have a list of those. What should people be on the lookout for?
So the biggest thing is a real sense of not feeling well and your heart racing when you're standing. But also you can feel chest discomfort while you're standing, and you can feel anxious when you're standing. You could feel, you can get headaches. Those are some of the big ones for sure.
And Victoria, you've been living and surviving with POTS for a little while now.
Yeah.
So how important is it to find that right doctor, to find a doctor that can help you along the way?
I wish I had perfect words for that. Finding the right doctor is imperative. And the reason why is because there are so many POTS patients that go years without a proper diagnosis. I was considered, I would say, one of the lucky ones. It took me close to a year before I finally fell into his hands. But before that, I went through 3 other cardiologists. And so imagine going years with your heart racing, feeling like you're running a marathon. In my case, I was somewhat bedridden and not knowing, and then looking at doctors for help, and then that doctor says, I don't know, and I don't even know where to send you.
What was your experience like? Because I mean, I've talked to you before, but for everyone else out there.
Yeah, so it literally was, well, we were talking about this. It was kind of a trickle effect over the course of a couple of years, but there was one thing that kind of made it explode overnight, and my life was never the same. I went from being just fully functioning to, I mean, I ran in a triathlon. I mean, I competed in a triathlon, to 6 months later, bedridden, had to move back in with my mom, had no idea what was going on, and it was exhausting. I couldn't even sit up in bed without feeling like I was going to pass out.
That's crazy. And you know, for people that, you know, might be living with it right now, what are some advice from both of you?
So the biggest things are lifestyle modifications if you have the diagnosis. And so salt, a high salt diet. I'm the only cardiologist in the city who recommends salt to my patients.
Right.
Lots of water, hydration is very important. Exercise is part of our management, but you can't exercise upright to start off with because you're already allergic to gravity. And so you start off with rowing machine, recumbent bike. There are specialized exercise protocols we recommend to our patients. And then slowly over time, you introduce upright exercise. And that exercise is really important. But then we have medications that can lower heart rate for our patients. Then we have medications that can boost your blood pressure, because some of our patients have low blood pressure with their POTS, and other patients have higher blood pressure with their POTS. And so giving someone a heart rate lowering medicine that will lower your blood pressure too won't always work. And so you have to have a blood pressure booster with it.
And we do have some good news to close out this segment. There may not be a cure, but you are in remission. I am so happy for you with the work of Dr. Muldowney. Thank you both so much.
Thank you for having us.
Thank you for having us.
Oh, of course. You can find more resources on POTS online. Visit VUMC.org.